Fatty liver disease is a growing problem in Utah, and some doctors are calling it a crisis.
It was slowing me down. My memory wasn't all there.
Turns out 69-year-old Kay Radford from Mapleton had chronic liver disease and late-stage scarring of the liver.
When they said I had cirrhosis, it's like, I don't drink.
Radford suffers from NASH, or non-alcoholic steatohepatitis, the most common form of chronic liver disease in the U.S., impacting roughly 100 million people.
What that means is that you get enough fat in your liver that the liver cells blow up and explode. And then cells come in and mop that up, and that causes the inflammation part of NASH.
Dr. Richard Gilroy is a hepatologist and director of the liver transplantation program at Intermountain Medical Center. He's dedicated to detecting the problems early. One way is through the FibroScan machine.
And we're doing a novel study here now where whoever walks into the room with the patient with cirrhosis related to NASH also gets a FibroScan. We discovered so far 4 patients with cirrhosis who were the partners of the person who came in and didn't know they have it.
Usually there are no signs or symptoms until it becomes advanced stages of liver disease, which is what happened to Radford. Her condition so bad she needed a liver transplant.
She faced a 2 out of 5 chance of dying before she got one.
After 2.5 years of waiting, she got a new liver several days before the new year.
The memory's coming back.
Good. She was constantly faced with that risk of death.
Dr. Gilroy says this becomes a vicious cycle.
If we can't find it earlier, we're already set up for a perfect storm.
With an organ shortage and a large population suffering from fatty liver disease, some could die waiting for an organ transplant, and the organs available may be unusable.
The problem with the fatty liver crisis that affects up to 30% of the population. Their livers are fatty. They're very, very challenging to use.
Dr. Gilroy says know your risk factors: high cholesterol or triglycerides, metabolic syndrome, obesity, sleep apnea, and type 2 diabetes.
And most importantly, we need to change what we do. We need to change our diets. We need to exercise. And we really need to drink coffee.
Dr. Gilroy even bought his department a coffee machine to encourage his patients and coworkers to drink coffee. He says studies have shown there are fewer cases of liver disease where patients are drinking coffee. He also recommends a Mediterranean diet.